All right. So just 4 quick objectives for today before I pass it off to Melissa. So by the end of the session today, we hope you really understand the Montana Family to Family Health Information Center and its role in supporting children with healthcare needs, understand additional data related to students with healthcare needs and their families. We'll discuss challenges faced by these students and then explore some really incredible resources to support these students. I had a chance to connect with Jen while we were planning this session and was like frantically writing down all of the suggestions that she had, many of whom I think might show up in some future Shine sessions. That's a hard one to say. So I'm going to pass it off to Melissa Eastlick from our Montana Peds team to talk a little bit about, just really briefly, why are we bringing this topic forward today? For those of you that have been with us for a while, you remember our first full year was focused on diabetes. The first session of this month was also on diabetes. And then we kind of pivoted and we went towards some mental and behavioral health work. And this is another topic we're throwing in. So Melissa, take it away. Let us know who you are. Let us know why on earth are we talking about this today. And then I'll let you introduce Jen.
All right. Well, thank you so much for just letting me pop in real quick. And I'm really excited to introduce Jen. Just FYI, I had everything written out and I lost it on my computer screen. I don't know why computer screens are so messy the way that they are, but I'm Melissa Eastlick. I am a social worker by professional by my professional nature, but I am also the CMC, or Children's Medical Complexity Program Manager, along with the Patient and Family Experience Advocate, longest title in the world. Essentially, what that shares is that I have been tasked with the beautiful job of launching a complex care coordination pilot program that has been funded through our HRSA grant. We just launched it we just opened our virtual doors this last June within this program. So this kind of falls under your outcome number 4, maybe a possible resource that might be helpful to families or children that you are supporting in your school. But the complex care coordination program is here to support both the child and the family to help navigate their medical needs, as well as any other social health related school types of needs as well. Kind of a whole child well-being in that sense. So, and we put this quote up today from Families' Voices. It's one of my very, very favorites. In fact, I might have to print this off without my picture and put it up on my wall. Because as we're talking about children with specific healthcare needs or medical complexities or anything else, we always have to look at the whole family, because the family is the most consistent healthcare provider there is. The family goes with the child and navigates the complex medical systems every day. The family is the communicator and the coordinator and the chief and the sole provider across the medical settings. The family is at the center of the children's healthcare. So with that leads us then forward to how we best support children who have those specific and special healthcare needs as well. So with that, let me introduce my friend and colleague, Jen Banna. She is the coordinator of Families to Families, the Montana Families to Families program from Families' Voices, as well as a family advocate, and doing a huge amount of support and work for families all throughout Montana, on behalf of families all throughout Montana. So take it away, Jen.
Thanks for that introduction, Melissa. Kate, I think you can go to the next slide. I just want to thank everybody for being here today. And I know you have other ways you could be spending your time. And Melissa, that introduction by Nora was very sweet. Nora has recently passed away during these last couple of weeks. And so I've been thinking about her a lot and about that quote. So I appreciate you sharing that. And I'm just really grateful to be here with you guys today. So let me get myself caught up to where I need to be with my slides. So as we were talking about acronyms, one of the acronyms that you hear a lot, and Melissa didn't use it in the introduction, but is the Children and Youth with Special Healthcare Needs. And so I like to set out the definitions at the beginning so that we understand when I'm using that phrase, what that means. And I mentioned to Melissa, if you have questions or anything, you can type them in the chat or raise your hand. But this definition is actually from 1998, and it's used throughout the federal government and Montana state government. children and youth who have or are at increased risk for chronic physical, developmental, behavioral, or emotional conditions, and who also require health and related services beyond that required by children generally. So in a lot of ways, that's all the kids, or any of the kids, or many of the kids. Definitely in our work, we don't turn away kids because they don't have enough of a condition. Many of us are only a day or an accident away from having new medical needs that we didn't previously have. Next slide, please. And so, yes, the first part I'm going to go over, these are in a little bit different order than the ones I have in front of me, Kate, but that is just fine. So this was, So this is the slide I thought was going to come up first. So we're going to talk about how we support children with healthcare needs and their families and everybody that works with them. Next slide. And then this is our funding statement. Melissa mentioned that they are also funded by HRSA, which is the Health Resources and Services Administration. And the things I'm going to share today are not necessarily the opinions of HRSA, but this presentation and my project are funded by them. Next slide, please. This is just a quick slide to show you that we've got quite a number of staff. All of our staff are parents of children who have had extra types of healthcare needs or behavioral needs, or children that have been on different waivers in Montana or had different struggles in school. Our model is a peer-to-peer model. So we have staff who can talk to family members about the situations that they're navigating in a way that I've been there too. I had a similar experience, and that's a really important piece of our work. Next slide, please. So this is what brought me to this work. This is my family. The two little boys are my grandchildren, and the young lady in the middle in the maroonish colored sweater is my daughter, Hallie, and she has a rare 18th chromosome deletion called Pitt-Hopkins syndrome. She wasn't diagnosed until she was 12, and that was 12 years ago, and she was one of 500 in the world. The small picture next to that is my children at another one of my daughter's grave out at the cemetery. We had a daughter who passed away from a physical disability also. So I've navigated some different sides of that situation. And then one of my grandchildren has a lot of behavioral issues and concerns. So I've gotten to get more and more life experience. It just continues. So this is the first interactive part. I know you guys probably see that there's a bobcat on there. I went to school at Montana State University. I live in Missoula, but I'm a big bobcat fan. So there's a strategy sometimes in Zoom called a waterfall. So when I say go, if you have a cat or grizz preference, put it in the chat. If you have no preference, you can put no preference, but let's just see who's in the room today. Go. Cat, grizz. Cats. All right, both. Oh, I love it. Both. We've got some of those split families, no preferences. Oh, Montana Tech. That's true. I probably should have broadened out a little bit there. MSU grad, and yep. So a lot of us are split in all those different directions. I think it's fun to see. And this time of year, a lot of us are thinking about which team we've been following and who we're going to follow the rest of the season. So next slide, please. Okay, so I'd already mentioned that family-to-family health information centers are funded by the Health Resources Services Administration. That funding comes down through the Title V Maternal and Child Health Services Block Grant. I'm going to end out using language like that and kind of providing a setting so that you have that background if it's helpful to you. And since you'll have the recording and I'm fine with Kate sending out the slides, you can always go back to that and look at that later. That Title V Maternal and Child Health Services Block Grant funds a whole bunch of things in Montana for moms and babies. For the family-to-family health information centers, there's one in each state, territory, and some reservations, mostly in New Mexico and Arizona, and they are family-led. So if you have a family moving to another state, there's a family-to-family health information center in that state also, and so they can reach out to them. And also, each one looks a little bit different. In each state, we are supposed to try to figure out what our state's needs are and what the families need and what the people that work with the families who have kids with extra healthcare needs need, rather than everybody doing the same thing in every single state, because Montana's needs are very different than Rhode Island's needs or another state's needs. Next slide, please. Okay. And then So what are the roles that family-to-family health information centers do? So all of the centers provide experience support to families of children and youth with special healthcare needs. And then we also assist providers, agencies, and legislators in better understanding and serving children and youth with special healthcare needs and their families. Next slide. So my grant is at the Rural Institute for Inclusive Communities. And again, I should have said a little more about this. I like to give that background because for some of you, you might be making some connections. You may have done other work with the Rural Institute for Inclusive Communities. You might be aware of MonTECH or the Deaf Blind program. They've had a number of programs there. And so I kind of want everyone to see where my program sits. And then we're going to talk, like I said before, like it was in the goals, about some data. I really love to look at data statistics, and I think it helps us understand sometimes the bigger picture. So the Rural Institute is a university center for excellence in development of disabilities. And Melissa actually has experience with one of the programs that we have that is leadership in neurodevelopmental and other disabilities program. And Melissa and I are both graduates of that program. If you have questions about that, I'm sure she can help you. The mission there is to build access and opportunity for people with disabilities through education, research, evaluation, and service. So the Rural Institute has over 50 programs that serve Montanans with disabilities and the providers and programs working with them. So the Rural Institute is a great place to call anytime you might have a statewide related disability question. We have a number of different research programs and evaluation programs. And then we also have close relationships with other state organizations. And so sometimes we know we can get you to the place you're looking for if we're not that place. Next slide, please. So now we're going to talk a little bit about the data related to students with healthcare needs and their families. And I'm going to start with some national data and then move into some Montana data. The data helps me think of things that I was surprised by some of this data, but I think it helps us recognize what might be going on with some of these families and individuals as they're coming into our classrooms or our clinics or our offices or wherever we're serving them. Next slide, please. So, and I know that data can be a little bit overwhelming. The blue side on this slide, in case it's a little small, is the children and youth with special healthcare needs. And the orange one is children and youth without special healthcare needs. And this is from a 2016-2017 survey about adverse childhood experiences. So you can see in that first column there that families who have a child with a special healthcare need, it's more likely they're going to have a hard time covering basics like food or housing. It's more likely that their parents or guardians may be divorced. It's more likely that they live with someone who's mentally ill, suicidal, or depressed, or that they lived with someone with an alcohol or drug problem. And some of these surprised me a little bit, and I kind of enjoy talking about the data. They have twice the likelihood of having a parent or guardian that served time in jail. And I think to myself, why? I have some curiosities. I don't know why these things are all true. You know, some of the stress that we know that happens, or the economic struggles that we know that can happen in families who have children with extra healthcare needs. But we also know that children with extra healthcare needs are born to all families all over, and they occur in all kinds of family situations. They're more likely to have witnessed domestic violence. They're more likely to be a victim of or a witness of neighborhood violence. They're more likely to have been treated unfairly because of their race, and they're more likely to have a parent or guardian who died. And so I just think it's important to think about how much more often those groups of kids and their families may be experiencing these types of stresses. Next slide, please. When we look at what's going on in Montana, 80.8% of children and youth with special health care needs in Montana and their families report they do not receive care in a well-functioning system. And, you know, everyone has a different idea about what a well-functioning system is. And I think this speaks a lot to some of the work that Melissa and Kate are doing. But I think we know, because you might have to travel to one city for one thing and another city for another thing. And in fact, you might have to travel out of state for the next thing, trying to get all of that stuff coordinated into one place where you can understand it and the test results are there. and the insurance is covering the things properly. It's just a huge system. And I think any of us who have dealt with the medical system understand that it doesn't function super well for lots of people. But when you add in a lot more doctors, a lot more geography, all those kinds of things that we see in Montana, that's a pretty high percent of people that say that their system is not, they don't think they're receiving care in a well-functioning system. 15% say that they do not have a personal doctor or nurse. And this is a statistic that we've talked about a little bit at the Real Institute. And one of the reasons for this may be because they're using an emergency room or an urgent care for a lot of their visits. They may not be living in the same parts of the state for the entire year. They may be going back and forth between parents or different family members. But that can also complicate whether or not your system is well functioning because you don't have even a primary care provider that's involved. So 1 in 5 children in Montana are categorized as children and youth with special healthcare needs. And that's a national statistic also. It's a little hard because we don't have a dedicated children's hospital. We have a lot of providers who are pediatric experts now, many, many more than we had when my child was younger, but we still don't have that dedicated children's hospital. And then I saw a little bit in the chat where people were from, but many of you probably know that Montana ranks 5th in mental health care deserts. So we have there's only 4 states that have a shortage that's more severe than ours for mental health care providers. So at least 35% of our population is underserved. That is an entire population statistic rather than just a children's statistic. Any of us that have children can probably take that down and know that there's even less mental health care providers who are pediatric specific or specific in any way. One other thing, since I know many of you work at schools, is that nationwide, children from 6 to 17 years old who have a special health care need are engaged in school at about half the rate of their counterparts who don't have a special health care need. So they're finding it a lot more difficult to engage in school. And I think there's a number of reasons for that. And we're going to talk about what you guys have seen in your work, because I think you probably have a high awareness of why that might be. Next slide, please. So this is comparing Montana to the United States in terms of percent of children in Montana who have special health care needs is 20.8%, which is pretty close to the national percent. I think it's interesting to look at the different ages. So 15.1% of those 0 to 5s, then 32.5% of the 6 to 11s, and then 52.3% of those 12 to 17-year-olds. Again, I think pretty close to what they see at the national level. Next slide, please. And then this is just by gender, because like I said, I'm a little bit of a data geek. And so I wondered, is there differences? And again, this is pretty close to the national statistics. And there's some information on why boys might be diagnosed more often with certain types of special health care needs. And I think we're seeing that catching up. I would expect that to keep getting closer. And then next is the income information. So this is the percent of kids who have a special health care need by household income with the federal poverty level. Now, I can't say that I understand the federal poverty level completely. And when we say that above and below the federal poverty level, that information isn't always clear to me. But I do know that's saying that 25% of our kids with special health care needs are their families. If they're in a family of 4, you can see there on the bottom what their income is. So again, pretty close to what we see nationally again, but a lot of families are really struggling financially in addition to these other struggles we've seen. Next slide, please. Okay, so this is where I'd like to do a little bit more interaction, and we only have 18 people on here, so I am completely fine to have you typing in the chat, raising your hand, going off mute, whatever feels most comfortable to you. But with what we've just seen and what we've talked about, what are you seeing in the communities you work with, or how would you describe those barriers or challenges that are faced by those students and families? You guys are on the front lines of this. This is just what the data is saying. Any surprises? Anything you would agree with or? It's a lot of data, so it's fine for it to soak in for a minute. That's a great one, Dawn. Transportation, poverty. Transportation's a big issue. Financial challenges. Yeah, getting to school is a problem. And the diabetes, I was really glad to see that there was some of the people from the state diabetes, because that is one of the conditions, one of the extra healthcare needs that we do see a lot at school. So the cost of their condition, the management of supplies. Yeah, managing supplies is a whole nother game in Montana also. Anything else? I want to give people a minute if they, loss of housing. Time and distance to seeing providers, right? Which then we've got kids that are out of school, families that then are, I always think, like, if the families aren't at work, they're risking their health insurance, they're risking all these other things, but they have to go to appointments between 8 and 5. Education level of parents' understanding. And, I would add to that one a little bit too, Dawn, which is the way that we educate everybody about things like this. Like, a lot of the information that I get from the state or other places, I can't really understand. So, I think that I would hope that we see an increase in putting things at a level where everybody can understand them, so that even if you have a lower education level, you can be able to see it. Getting kicked off of Healthy Montana Kids, losing your health insurance. Yeah, these are all good ones. Medicaid and HMK, and that adds a lot of stress to families, right? And what we've seen after COVID with the Medicaid unwinding, that really impacted a lot of families. Is there anybody who would like to add a little bit more to what they said and what that looks like? Maybe the person that was talking about transportation. How do you see that as a barrier, or what are you hearing from families where you are? And nobody has to go on the spot. If you don't want to go off mute, you don't have to.
I didn't bring up transportation, but I would say we always have a challenge of, a benefit of having providers from local health specialists that can help our kids. But then when they're required to go to Kalispell for some of the procedures, it's such a barrier. And so far, I haven't had a lot of success with support for those families getting there. Maybe it's transportation, and maybe it's as simple as transportation, I guess, and then beyond.
I was just going to say, I live in Great Falls, which is obviously one of the big cities. I have kids regularly that go to Billings and Helena and Missoula and Kalispell for, several times a year to each town to see providers.
And unreliable vehicles. Yeah, these all, it ends out really stacking up, doesn't it? And when we look back at that other data that we talked about, a lot of these things are just stacking upon things. It's not accurate for all the families, but it's definitely accurate for some of the families who have kids with healthcare needs and some of the families who don't have kids with healthcare needs. So those of you that are working in the schools are seeing that all the time, juggling all the condition management. Yeah, it's a lot for all of you, and then it's a lot for the families too. So we're going to talk about, I do have a travel resource that might be helpful for some of your families, but I appreciate you guys sharing with me the things that you're seeing. And transportation is something I'm going to make a note, because I think, especially when we talk about Montana, I want to find some more data about that, because I think that's a really big issue. Next slide, please. So I am not by any means an expert on any of these things. I'm a mom and a nana who's navigated a lot of these resources for my kids and my grandchildren, and I've helped other families connect and navigate these resources. There are probably way more out there. If you think of any as we're going through, when we have the chat time later, it would be great if you guys would share different communities. All respond to these challenges in very, very different ways, and so do families. But families and communities, in my experience, can often be pretty creative at finding ways to solve some of these issues. And so we can always look to other families in our schools or other schools in our system to find some information. And that's one of the things I wanted to make sure and say is that families also, often families with kids with these extra healthcare needs can feel very isolated, especially, and so can their child. The child is not in school as much. The parents aren't at the school as much. And one of the things that in the past, I think schools and medical offices have been reluctant to do is to connect parents to each other. And so if you're at the school and you're hearing from more than one parent that they're having a similar struggle, or you have a parent that has solved a problem in a unique way, I think it is very respectful to say, could I connect you with another parent? Could I share your information with another parent? The parents who are learning about the resources and figuring them out, when they say to another parent, I have an idea that might work for you, parents often connect and you all feel this way too. You connect with somebody else who has that in common with you, that peer-to-peer thing where you're like, oh, you get me because your kid has special health care issues, or you get me because you work at the school. And so I would encourage all of you, anytime you're hearing those things, if you feel comfortable just saying like, I have another family who I think might have some things that might be helpful for you, or I know another family that might like to hear your story. It really helps with the mental health of the families and probably even the kids in these situations to hear from other people who are having that shared experience. One of the things that we do that I didn't include on this slide is that we have a sibling program called Sib Shops that we do about 6 times a year on Zoom, where we invite siblings of children who have extra healthcare needs to do like a 90-minute Zoom with us. And we have a social worker that comes on and spends about 90 minutes with them doing activities that they get in the mail and talking about what can be difficult about having a sibling with a special healthcare need. And the kids are amazing, the things that they notice. And they, for the first time, realize like they're not the only ones that like don't like to go to the restaurant with their sister, or that, their brother pinches them. And so that peer-to-peer support is invaluable throughout the entire family. And so that's something that's been really important and helpful to me. So I'm going to kind of whip through these resources, but again, you'll get the slides. So this first one that I wanted to talk about with you all is called care mapping. So care mapping it provides like a comprehensive picture of a family's needs, and it can enable anybody on the team to appreciate how the aspects relate to each other. These are just 2 different examples of care mapping, and there's a link at the end that you can go to and if you want more information on care mapping. But sometimes this can help you when you put like the child in the middle or the family in the middle, like Melissa was saying at the beginning, and you have them start talking about all the different resources and all the different things that they're doing or trying to deal with. And you might see that transportation comes up on all the different sides. Some people like to color code them. Some people like to put the names of all the people that are helping them or working with them. But sometimes it's a great way to kind of map out and see all the different agencies or organizations or groups that the family is dealing with. And then you can see like, oh, is transportation an issue throughout all these things? Is there an entire group of things that the family isn't aware of? Or is there so much overwhelm going on that like it's not a good time to try to bring in new things or start to do new things? So care mapping can be used in multiple ways. It's something that you all can use with your own families. We're all dealing with multiple groups, multiple sources of information. So care mapping is a nice way to work on that. Next slide, please. And then this is about family-centered care. And this comes again from Nora Wells' work and some of the work from Family Voices. And I'm going to bet that a lot of you are already doing these things, because when you care about children and families, a lot of these things come naturally as you're listening to them talk. Acknowledging that the family is that constant, whoever's showing up at the school with that kid is the same one that's showing up in lots of different places. And we like to acknowledge that the definition of family might be different for different people. I have a 30-year-old daughter who often goes to appointments with some of my other children. And obviously she's a sister, but I think a lot of times we would look to parents or guardians to be that consistent family person. And sometimes it can be grandma or an aunt or somebody else that's involved with the family. Krista, did you have a question? and then building on the family strengths. And that's why sometimes doing that mapping, you can find out some things that maybe that child or family is interested in or wants to be involved in that maybe you didn't even know about because the child isn't in school enough or doesn't have the opportunity to have those conversations. A family-centered care supports the child in learning about and participating in his or her own care and decision-making. And I think this is another one. Oh, no worries, Krista. This is another place where I think my opinion as a mom is that this can start so early with kids, being able to include them in their own decision-making and their care in meetings where that makes sense and it's possible, or where they can come to part of a meeting if you're having meetings about them and answer questions. I feel very strongly that this helps kids grow into the next phases and the next phases and the next phases of making decisions as they grow into adults. And it gives them some control over their care or their situations to be able to say, like, I prefer blue bandages, or I want to sit by the door of the classroom so that I can get out quicker when I need to ABC. And so having kids make some decisions about a good place to sit, or a color preference, or a code word for something. Yes. Thank you, Michelle. We've had some discussion about Seattle Children's. Michelle's talking about how Logan Health has a children's hospital in Kalispell. And we have, and that's true. Do you know, Michelle, I know you and I have talked before.
Yeah.
I wondered about what the definition of a children's hospital was when I was typing up that slide, because I wasn't sure. Do you mind talking about that a little bit? I'm sorry, this is how my brain goes, people. So there you go. You just saw it. We're going to tangent for a minute with Michelle.
Yeah. No, I mean, I'm not exactly sure what, as far as the definition of a children's hospital, I know that is the only that I'm aware of designated children's hospital that can care for pediatric patients, right? I mean, I think there's certain conditions that they still have to go elsewhere, but a majority of pediatric patients they're able to support, and they have a full NICU, which there are others throughout the state as well. So yeah, and they've been around for about 5 years. And and then our specialty, our children's specialists go kind of throughout Montana, but not really over to Billings area.
Right. My family met with Dr. Fleming last week from Logan Children's.
Isn't he wonderful?
Oh, he is. Community Medical Center does some pediatric things too. And I think you bring up a good point. There's probably some hospitals that are doing some of the pediatric care for some of the conditions very, very well. Some of these more rare kids or the more complex kids are probably ending up going out of state. Do you think that's a true fact or a true statement?
I think for various parts, right? We don't have nephrology. There's certain things that we don't have, right? And I think like we don't have a neurodevelopmental clinic, which Seattle does. I used to be the social worker there at Seattle Children's. So there are definitely, certain specific things that need to be sent out. But there are a lot of specialties that we have that we are able to do. I think that wasn't previously happening. So just want to make sure people are aware of that. Yeah.
Yeah, thank you. And I think that's growing and changing, right? All of these things are growing and changing. When we get somebody that wants to live here in Montana that has a specialty, they come right in, and all of a sudden we have one geneticist. I think we're getting a second one, but it's because he loves Montana. So a lot of times it's by luck that we they marry nice Montana people and then come back. Family-centered care also honors the cultural diversity and family traditions, which again, as you talk with families, you learn about. They recognizes the importance of community-based services, which we've talked a little bit about how there can be a lack of those in some of our areas. Promotes individual and developmental approach, encourages family-to-family and peer support, which I mentioned earlier. Supports youth as they transition to adulthood. I have some links at the end that will be helpful for those of you who are working with older kids or young adults who are transitioning to that from 17 to 18, which is that into adulthood transition. I'm not going to talk a long time about those resources, but they're there for you. Developing policies, practices, and systems that are family-friendly and family-centered in all settings. And one of the ways we can do that is by including families and individuals when we're creating policies, practices, and systems. Instead of saying, we have this great system we've created for families. Here you go, families. Do you like it? And the families might be like, what I really needed was this, but that's nice. So sometimes when we ask or when we involve the people that the systems are for, we get better outcomes for everybody. And then the last piece of this is celebrating those successes. And as I'm saying this, I'm feeling like, this is a really big list for people who already have really big lists. So this is more just to maybe bring to the attention of everybody here today that there's lots of different ways to do it, and maybe think about what is happening where you are. Next slide, please. That is the next question. So the next question is, what aspects of your work with children and families is going well? What are some specific strategies or practices that you have found to be really effective? And we can talk about those more in the chat section if you want to, but if anybody has anything they want to share right now, and then I'll launch into the specific resources. I think what I'm going to do is go to the resources, and then we can go back to this slide and talk about it at the end. So I hope you all already know about MonTECH. Every time I talk about MonTECH, I just want to go, ah. So they're my favorite thing to talk about. Why don't you guys indicate in the chat, does anybody know about MonTECH? Has anybody used MonTECH that's here with us today? Yes. All capital. Yes. Okay, right. No, I know about it. Okay, this is great. So the capital yes with the exclamation point. Yep. They are so awesome. They provide technology and support and services for anybody in Montana with any type of disability. They ship many of their things both ways for free. You can borrow assistive technologies and adaptive equipment from them. They have someone that will work with you one-on-one to learn about all the devices that they have, and the one-on-one work is free. They ship most items anywhere with shipping both ways. And like I said, anybody in Montana of any age with any type of disability, learning impairment associated with aging, things can qualify. So not just the kids you guys work with, but you guys and your coworkers and your neighbors and your aunt. If they live in Montana, they can qualify. They have everything from robots that can feed you to keyboards that work better with computers. I would encourage everybody to go on their website and look at the things they have. They have bikes and trikes, and yes, thousands and thousands of dollars in things that they want everybody to check out and use. And so everybody should look at the list there. And anyway, I love them. I wish I could just do presentations about them because they're so fun. Next slide, please. The Montana Empowerment Center is another resource. Their mission is to empower, encourage, and educate all Montana families with children and young adults with disabilities. I like to say they're one of our sister or cousin organizations. They know all the things school, and they understand the things that the rules and guidelines that families need to follow, that schools are following. They just provide families with information like this is how you could ask for a piece of equipment if you need to use it at school, or if you'd like to make a change to an IEP. But they're great for working with students and school and people from schools. Next slide. And then this is a financial assistance program through Children's Special Health Services, which is the Department of Health and Human Services. They can provide up to $2,000 per year for financial assistance for treatment and enabling services for qualified children and youth with special health care needs. And I think it's 300% poverty level. So this would be something you could pass on to families who might be struggling to get different things from their insurance. They can help with insurance copays. They can help with things that a doctor says the child needs to be healthy that aren't covered in other ways. And they could also help with some of the transportation things that we were talking about. Everything is done on an application by application basis, and it's based upon the individual needs of that child. So in no way do they say we can cover everybody's this or everybody's that. It's very much based on the child's needs and the child's diagnosis. The next one is the Jaden Fred Foundation. This is a foundation out of Missoula that serves the whole state, and their mission is to provide financial support to families who need to travel for high-level medical care for their child. I know that they have funded families who traveled for low-level medical care for their child. Also, they were founded by a family who lost their child at a young age to cancer, and they were traveling back and forth to Seattle and just found it to be such a burden that they didn't want other families to have that burden. So that's another resource for families. The Marshall and Mary Brondum Special Assistance Foundation is also a Montana-based foundation that's set up to financially aid individuals whose needs are not or cannot be met by already existing charities and or agencies. And their website is also at the end of this presentation. Next slide, please. Okay. list of helpful resources, and most of them we talked about: the care mapping, family-centered care, the Empowerment Center, MonTECH, Rural Institute, Children's Special Health Services, Montana Pediatrics, the Diabetes Alliance, and then the Brain Injury Alliance of Montana is another organization that I've worked with. Next slide, please. And the Epilepsy Foundation of Montana, they recently now have a person in Montana that's covering Montana. Jaden Fred, the Brondum. There's the link for the transmission resources, which is mostly as a child's moving from childhood to adulthood. I also threw in some information about guardianship and supported decision-making, because that's something else that's happening at that point. And then Disability Rights Montana has a mission to protect and advocate for the human, legal, and civil rights of Montanans with disabilities. And so they're also another all over great place to call with questions about, like, is this okay? Is that okay? And they have on their website, they used to have that you could schedule a time to meet with them through their website. And then this last one is the Centers for Independent Living. And that link will take you to a map that will show you the Center for Independent Living that serves the part of the state that you live in. There's 4 independent centers for independent living, and they're not places to live. They provide services for anyone with a disability, including children, students, adults. They're private nonprofits who are managed mostly by people with disabilities. And the services they have are usually around information and referral, independent living skills, peer mentoring, individual systems and advocacy. And so they can help with a lot of those things also. And I think that's the quick fire hose. There we go.